Today's strategy session, as many people push for universal health care, they may want to take some cues from the state with the highest percentage of people who do have health insurance. That would be Massachusetts. The former Massachusetts governor and former Republican presidential candidate Mitt Romney was key to making that happen. Now he's talking about lessons learned. He's specifically talking with our chief medical correspondent, Dr. Sanjay Gupta.
We really were unable to deal with and didn't have any pretense that we would somehow be able to change health care costs in Massachusetts. We still have a fee-for-service reimbursement system here like every other state in America. That's the way Medicaid and Medicare are structured. That's the way the insurance industry is structured. That's a whole different topic, which is how do we get the cost of health care down in America? And as you know, we're way above the cost of health care of any other country in the world as a percentage of our total economic vitality. So that's a different topic. We didn't deal with that here in Massachusetts, and frankly, we dealt with a much more narrow issue, getting people insured that weren't insured, and this is just as important, perhaps even more important, for those who are insured, making them understand that they will never lose their coverage. If you're in Massachusetts and you've got coverage and you lose your job, you're always going to be covered. You don't lose your insurance. That was critical.
Should the president be looking at Massachusetts as a model of lowering health care costs?
No, Massachusetts is not the model with regards to the second problem. Massachusetts is a model for getting everybody insured in a way that doesn't break the bank and that doesn't put the government into the driver's seat and allows people to own their own insurance policies and not have to worry about losing coverage. That's what Massachusetts did. What we did not do was say, how can we change the reimbursement system, align incentives in health care with doctors, with hospitals, and with patients? That's what needs to be done if you're finally going to rein in health care costs in this country.
President Obama does talk about health care costs. He talks about this idea of bending the cost curve down over the next 10 years. He does talk about creating a system that, as you say, pays for itself. That is what you hear when he is talking about health care reform in broader brushstrokes. Do you not believe him, or do you think it's just the details aren't there?
Well, I haven't heard any measure being proposed by the president or by the members of Congress that suggest a change in the way incentives are going to be structured, or any other measure that will lower health care costs in America, with one exception. And that is they're saying they're going to cut $500 million out of, or $500 billion rather, out of Medicare. Now, that's not bringing down health care costs. That's jamming a burden on America's senior citizens, saying we're going to take cost out of your system. Either it's going to be on their backs or on the backs of the hospitals and the doctors. But it's not saying, how can we make health care more efficient, more effective, providing care in a more advanced, technologically efficient way? And that's not something I've heard anything come out of Washington discussing and putting in this piece of legislation.